Right now, your body is running 13 tiny fail-safe switches, and if one stops working, the first warning might be bruises, pins and needles, or not seeing well at dusk. Vitamins make the most sense if you think of them as tiny switches with specific jobs. When one starts running low, your body usually does not wait for some big dramatic collapse. The early signs are usually small and local. Sore corners of the mouth, easy bruising, trouble at dusk, or pins and needles. The corners of the mouth crack, your tongue feels sore for no clear reason. Your skin gets irritated and stays irritated. You feel a low-level tiredness that seems too small to explain much. These mouth and skin changes are often where several B vitamins show up first. B2, riboflavin, is one of the classic vitamins for mouth tissue. When it runs low, the first things to go wrong are often the surfaces that get replaced fast. The tongue gets inflamed, the corners of the mouth split. Eating salty food suddenly hurts. B3, niacin, has a more famous late stage, pellagra, but the early version is often much smaller and easier to miss. Skin in sunny areas starts getting rough and irritated before the full old textbook picture shows up. In the early 1900s, corn-heavy diets in the US South produced exactly that pattern before people understood what they were seeing. B6 can cause some of the same mouth and skin problems, and it also affects nerve chemistry. B5 and B7 deficiency are rarer, but they still leave signs you can spot. Think irritated skin, burning feet, thinning hair, or a rash that will not come down. Several B vitamins first show up in tissue that renews fast, and that same pattern keeps showing up through the rest of the list. Your body is replacing blood cells all the time. That means it is copying cell instructions all the time. Folate and B12 are the vitamins that help that copying go right. When folate runs low, new blood cells start being made badly. They get big, odd, and inefficient before you ever get some big, obvious warning sign from the body. You may just feel tired, weak, and washed out. B12 overlaps with folate there, but B12 has a second job that makes it worse. B12 also helps keep nerve insulation in good shape. So a B12 shortage can start as a blood problem and then turn into a nerve problem. B12 shortage can show up as pins and needles because nerves start losing protection. Your feet go numb, your hands tingle, and you get a strange, clumsy feeling. Those signs can show up while somebody still looks mostly fine from the outside. And B12 is sneaky because the body stores a lot of it.
Those stores can last 3 to 5 years, so a strict vegan or somebody after gastric bypass surgery can seem fine for a long time. Then numbness starts and feels like it came out of nowhere. It did not come out of nowhere. The tank was just very slow to empty. The first sign often shows up in the exact system that is running short: mouth tissue, blood cell copying, or nerve protection. One tiny missing compound and the problem gets strangely specific. You walk from a bright room into a dim street, and your eyes take too long to adjust. Driving at dusk feels a little worse than it used to. Dark restaurants become mildly annoying. Trouble adjusting to dim light is often the first clear sign of low vitamin A. Vitamin A helps your rod cells reload the pigment that lets you see in dim light. When vitamin A runs low, the first clear problem is usually not dramatic eye damage. It is slower adjustment to the dark. Dry eye comes later. Surface damage comes later too. Real eye injury can follow, but the first hint is usually simple. The dark starts feeling wrong. Vitamin D hits a totally different system. Your skin can make it from sunlight, which is why indoor life and living farther from the equator matters so much. Low vitamin D can stay vague for a while. Muscle weakness, bone pain, and just feeling off in ways nobody would guess are about vitamins at first. But the main problem is structural. Bones do not mineralize properly. In children, you get the old brutal picture of rickets. In adults, you get softer, weaker bone. Then you bump into a table leg, forget about it, and later find a bruise that looks much bigger than it should. Vitamin K helps switch on several clotting proteins so they can grab calcium and do their job. Without that step, the blood is still there and the proteins are still there, but the system cannot finish the job properly. So the early problem can be very quiet. Easy bruising, bleeding that takes longer to stop, or a lab test showing clotting time getting worse before anything dramatic happens. The machinery is there, it just is not switched on. Babies are born with low vitamin K stores, which is why they get a vitamin K dose after birth. Without it, some develop bleeding disease, including bleeding in the gut or even in the brain. One small dose prevents that. Tiny switch, huge consequence. Vitamin E usually becomes a problem in people who cannot absorb fat properly. Then the damage starts hitting nerves and muscles. You get weakness, poor balance, and numbness that can feel a lot like other nerve trouble. Cell membranes stop getting the protection they were supposed to have.
Thiamine, vitamin B1, helps turn food into usable energy, especially where demand stays high. When it runs low, nerves suffer first, muscles get weak, and in bad cases, the heart can start failing too. That disease is beriberi. In late 19th century Java, polished rice diets drove it hard enough that Christian Eichmann's chickens developed a nerve disorder that could be reversed. They were fed the same stripped rice people were eating. Put rice bran back in, and the birds recovered. Removing the rice bran stripped away thiamine, and the nerves started failing. Vitamin C is different again because you can watch the body lose its structural glue in real time. Collagen is what holds blood vessels, gums, skin, and wound repair together. Without enough vitamin C, the body cannot stabilize it properly. The structure starts failing in places you can actually see. This is scurvy, and scurvy is horrifying because it happens step by step. After about 4 to 12 weeks without enough vitamin C, the first signs can be fatigue and tender gums. That starts once body stores drop low enough. Then capillaries get fragile. Tiny hemorrhages show up around hair follicles. Hairs start curling into little corkscrews. Wounds stop healing properly. Gums swell and bleed. Bruises appear without much reason. Teeth loosen. Sailors on long voyages learn this the hard way for centuries. With no fresh produce for months, the body slowly starts coming apart. Not because of some curse, because one compound needed for collagen is gone. The honest version is that not every early sign is this neat. Fatigue overlaps with everything. Mild skin changes can mean 10 different things. Some deficiencies stay quiet for a long time. This works best as a way to read the body, not as something to diagnose yourself with at home. Still, the pattern is real, and once you see it, it is hard to stop seeing it. Which early warning surprised you most? The dusk vision, the bruising, the mound changes, or the fact that B12 can hide for years? So the next time vitamins get talked about as vague support, remember what they actually are. One keeps dusk from going blurry. One helps a bruise stay just a bruise. One keeps blood vessels, nerves, bone, and gums from slowly falling apart. That's why vitamins are not boosters. That's why the small signs matter first. That's why a strange bruise, a sore tongue, or trouble driving at dusk can be your body pointing straight at what is missing.